Next, in the newborn course, we will focus on the repeat newborn assessments and its importance. Please review the legal disclaimer. The objectives of this course, you will be familiarized with the importance of newborn assessments throughout the first months of life. You will also be able to verbalize key assessment areas to focus on during different stages of life after birth. The process of repeat or frequent newborn assessment aids in early identification, prevention, and treatment of complications that may arise with newborns as they transition in the first month of life. The standard intervals in which newborn assessments are completed are around 24 hours of age, day 3 to 5 postpartum, and 2 weeks postpartum. Key differences from an initial newborn examination. The initial exam is done right after birth, usually within that 2-hour time frame. The baby is checked at 1 minute and 5 minutes, checking the APGARs after birth. And the baby who needs help with any of these issues is getting constant attention within the first 5 to 10 minutes. This is typically done after the baby has nursed, been skin to skin with mother. Again, just key differences from the initial newborn exam. The midwife completes several focused assessments on the newborn throughout the recovery process. The initial complete exam is usually done again around 60 to 90 minutes after birth. Repeat examinations are done in the postpartum recovery stage and again at different intervals throughout the first month of life. Each of the repeat assessments are more focused and tailored to specific transition risk factors. At day 1 postpartum, cardiac transition complications are most common. This is also the time when certain screenings are completed, such as the CCHD or the critical congenital heart disease and the metabolic screening. This is an important time to ensure you are providing adequate breastfeeding support, addressing any urine and stool output concerns, and ruling out pathological jaundice. Many of these risk factors or concerns will arise in the first 24 to 48 hours after birth. Between days 3 and 5, postpartum is when you, as a midwife, should begin focusing your assessments on adequate intake and output. Around day 3 is the time that mother's milk typically comes in, or at least the supply and demand mechanism should be in full effect. As the newborn is learning to properly latch and activate the milk letdown, mom's breasts begin to experience engorgement, which may cause issues with breastfeeding. Focused assessments during this period will assess for adequate weight gain, adequate output, and watch for signs of jaundice. In the 2-week postpartum period, the midwife continues to focus on adequate weight gain, output, breastfeeding support, and also bonding. You want to prevent the newborn of failure to thrive. Okay, so let's dive a bit deeper, beginning with day 1 postpartum exams. In the postpartum period, the midwife is watching closely for signs and symptoms of pathological jaundice. When jaundice occurs shortly after delivery, it is more common to be a pathological rather than physiological cause. When assessing the newborn on the repeat exam on day 1 postpartum, look for the following symptoms: yellow discoloration of the skin, the mucous membranes, and the whites of the eyes. Looking for light-colored stools. There may be poor feeding seen in the newborn. Assess for lethargy or excessive sleepiness. changes in muscle tone, high-pitched crying, even watch for seizures. Weight checks are done to ensure that there is adequate intake and to help ensure that the newborn is getting enough nutrition. When providing breastfeeding support, the midwife is focusing on the initiation of breastfeeding following birth. It is important to understand the difficulties of breastfeeding and how to address those concerns. The midwife should also have awareness of when a mother needs a referral to a lactation consultant or requiring additional tests to rule out possible reasons for her inability to breastfeed. Also, communicating with the woman the benefits of breastfeeding for her and baby may support continuation of breastfeeding and encourage them to stick with it. Breastfeeding is difficult. While assessing the newborn and woman during repeat exams, you should also be educating the patient, focusing on enhancing parenting practices and behaviors, such as developing and practicing positive discipline techniques, learning age-appropriate child developmental skills and milestones, promoting positive play and interaction between parents and children, and locating and assessing community services and support. Additional screenings done in the first 24 to 48 hours includes the CCHD and metabolic screening. We review these tests in depth in other sections of this course, but to recap, the CCHD or critical congenital heart disease screening is done to assess for rare heart conditions in the newborn. The phenylketonuria or PKU metabolic test is done to check whether a newborn baby has the ability to properly break down a substance called phenylalanine. I believe that's how you pronounce it. It builds up in the baby's blood and can cause brain damage, seizures, and intellectual disability. Moving on to days 3 to 5 postpartum. In the majority of patients, women will be discharged by day 3 and 5 and will require either a postpartum home visit or return visit in the clinic. Midwives will usually spend about 1 hour with mom and baby to gauge how postpartum transitioning is going. At day 3 to 5 postpartum, the repeat examination and assessment of the mother and newborn should include the following. Assess the mother's belief on how things are progressing. You will get a lot of insight on the general health of mom and baby by asking open-ended questions about how things are going. In the newborn, the midwife will collect the newborn's weight, complete head-to-toe assessment to include the heart and lungs. In mom, the midwife will obtain a blood pressure. You will then want to complete a focus exam, looking to see if there are any vaginal tears, incisions from delivery, and if so, are there sutures in place? Are the tears healing, and are there any signs of infection? You will want to assess fundal height, ensuring that the uterus is descending back into its pre-pregnancy position, completing a depression screening, watching for signs of postpartum depression, especially as there is a major shift in hormones in the postpartum period. Other important aspects of a postpartum exam at 3 to 5 days includes assessing her needs for additional resources, such as referrals or recommendations for pediatricians, providing information on food assistance or WIC. Again, assessing if mom will benefit from a referral to a lactation consultant is also beneficial. Common educational topics are listed below, which are all topics that are discussed in depth throughout this course. They include well baby care, immunizations, ways to keep the baby safe at home while sleeping, in the car, and other locations. Ways on keeping baby healthy, as taking care of skin, mouth, umbilical cord, and circumcision sites. It also focuses on how the baby brains and body develops, feeding the baby, and signs and symptoms of illness. In the breastfeeding assessment of the newborn, you are assessing the infant's ability to latch and coordinate sucking, swallowing, and breathing. Again, monitoring input and output, behavior, and weight must be conducted regularly as the newborn develops. This assessment will again indicate if breast milk transfer is adequate and if developmental milestones are achieved. Early assessment and reassessment of infant feeding, growth, and development are essential and provide the opportunity to discuss any breastfeeding concerns and determine appropriate interventions as needed. When assessing the mother and newborn for issues regarding breastfeeding, engorgement is a common concern. When women are engorged, the breast tissue overfills with milk, blood, and other fluids. The breast may become very hard, swollen, and painful. Nipples can become flat and tight, making it difficult for the newborn to latch. There is a section in this course that goes further into breastfeeding complications and ways to mitigate them. As the newborn transitions to the extrauterine world, there will be many ways the newborn will try and adjust to those changes. Be sure to educate the caretakers on the warning signs that the newborn isn't adjusting well. Lastly, the 2-week postpartum visit is the next interval of repeat newborn exams. The 2-week postpartum exam is typically in an office visit, but can be done at home. Primary responsibilities of midwives in postpartum settings are to assess, provide education, and follow up closely on significant findings. This is the time where you will want to provide a copy of records to give newborn care providers after the first month of life and follow up on any referrals that were made prior to this visit. Many midwives find it useful to use the acronym BUBBLE to remember the necessary components of the postpartum assessment and teaching topics for mother's side of care. These include breast, uterus, bowel function, bladder, lochia, episiotomy, perineum, lower extremities, and emotions. Finally, the 2-week postpartum exam of the mother will include an examination of the heart, lungs, skin, vital signs, and a weight check. Breastfeeding support is a major focus area, especially if the mother is choosing to exclusively breastfeed. Breastfeeding support is a maternity care practice that has been shown to increase breastfeeding initiation and continuation among mothers who wish to breastfeed. In conclusion, the scope of midwifery for newborn care ends at first month of life. Initial examinations are comprehensive, and repeat examinations are focused on key transitional concerns. Day 1 postpartum, midwives will watch for signs and symptoms of pathological jaundice, signs and symptoms of infection, respiratory and cardiac transition, weight checks, breastfeeding support, parent education, CCHD, and metabolic screening. Day 3 to 5 postpartum, the midwife will assess, educate, and closely follow up on any concerns with mother and baby, particularly breastfeeding concerns with engorgement being commonly present. In the 2-week postpartum exam, make sure mother and baby bonding, Postpartum transition is also going well, including providing records so newborn continued care providers can start assessing the baby after the first month of life.